For those of you who have been following me for some time, watching our videos, reading my blogs, that we see a lot of physical therapy patients that come to us with back pain, especially back pain that's limiting their active lifestyles, their ability to perform in their sports or get after it in the weight room. In fact, back pain is the leading cause of disability worldwide. Now, there are lots of different things we need to do when trying to help somebody that has experienced back pain, especially if they've been dealing with it for a long period of time, right? We need to get the back being able to move more effectively, hopefully without there being any pain. Specifically, find what segments of the spine maybe move more than others, try to promote more mobility where there isn't much, and try to hopefully make it so that we don't have to compensate at the areas then that can move, because that may be the place that we actually have some of the pain coming from, because they're picking up the slack for places who aren't quite doing their job. Of course, we need to look at other areas of the body, see where there may be some mobility limitations, strength limitations, to maybe movement dysfunctions, if you will, that are putting more stress on the spine itself, because oftentimes the back is just taking the brunt of the stress for some other place not doing its job. And there are all sorts of different things that we could keep going on and on about that we need to get after in order to really be able to help somebody struggling with some of these types of issues. But in addition to that, there is a more simplistic piece we also need to take a peek at, which is, can the back handle the amount of loading that a person is demanding from it in whatever their activities are, right? If you're in the gym, it's got to be able to handle a lot of loading that might be going through the body. If you do something like a back squat, for example, where you're holding a barbell there, it's got to be able to handle all that compression. If you're doing a lot of deadlifts and things like that, has to be able to handle the amount of stress that goes into the spine when we are bent over, because what our spine is having to do against gravity is slightly different because the angle is different. And again, we could go on and on about that as well and take it into the stresses that differ greatly in our sports, because then we're moving in all kinds of different ways with high velocities for extended periods of time and all those great things. So when we are working on all the other stuff we need to be able to help somebody with back pain, we also need to appreciate that when somebody has been in pain for a long period of time, the loading tolerance of what the back can handle is less than it was previously, right? Because if we have pain, that pain's gonna basically signal to us quicker than it had prior to the pain, because it doesn't want to experience that again. So that alarm system is a little more sensitized when we have a history of back pain, and we need to desensitize things a little bit so that it doesn't go off quite as early all the time, and so that also the back can also be able to just handle more stress as time goes on. Because of course, if we are babying the back a little bit, rightfully so, if we have pain, it's going to become a little bit fragile as time goes on. So I recorded a couple videos recently that I oftentimes perform to be able to help with my history of back pain, make sure I still can handle the stress I needed to be able to handle for the activities I love. One of these drills is something we call a Jefferson curl, because a lot of times we're going to have to go into positions of lumbar flexion in our day-to-day when we're picking things up off the ground, or simply for activity in general. We can't be locked in extension and rigid all the time. So this is a drill that teaches us to be able to control and own all that flexion and tolerate it. And right here I'm going with just body weight, but we can even progress it to adding some weights in our hands. And if you look on YouTube or on the internet, you'll see some people doing this with actually a pretty appreciable amount of weight if their spine demands it, for sports like powerlifting or things like that. Another drill we can do here is a 45-degree hip extension. Here, I'm just doing a hold, because in this position, my back has to be able to work with my glutes, with my hamstrings, and of course my core, to be able to stabilize my spine in the position. And so it's being trained to do its job along with all the other areas of the body doing its job as well. And we'll oftentimes start with patients doing this with their hands maybe at their side. And then as it gets easier, they bring their arms up to maybe cross their arms across their chest, put it behind their head if they want, even holding a plate. And of course, you can go up and down with it as well. And then finally here, this is just a simple drill where we just walk out with a safety squat bar in this case, to just get the spine used to loading going through the spine. Now, you may begin just by having a patient do walkouts like this and then walk it back, and then they can even switch into doing some marches where we alternate from one to the other. And then eventually it's a really good build up to being able to then do those squats, of course, with this load as well. So these are a few examples of drills you may use with some clients, but of course it all depends on what the client's goals are, activities they want to get back to. So if you are somebody who has a chronic history of back pain, you're looking to finally overcome it, We would love to be able to help you by determining exactly what the cause of that pain is and then creating a customized plan, including maybe some of the exercises you saw here to be able to address it once and for all.